Now, for the follow-up of malnutrition, you need to know that when you want to follow up, you follow up clinically and you follow up paraclinically. Basically, and there are elements to follow up, particularly clinically, on a patient that has malnutrition. You have to take daily weight of the child. You take also daily height. You take also weekly height. You take daily weight. You take weekly height. Is it clear? You can take other parameters provided say go the weekly mid upper arm circumference. The daily weight, the daily height, the daily mid upper arm circumference. Is it clear? Those are the different elements that you have to take and monitor every time. Take the daily weight, the daily mid upper arm circumference, the weekly height. Is it clear? To find if it is changing. The second thing you have to find for edema, you have to evaluate for the grade of edema every day. Is it clear? You have to evaluate if the appetite test, you have to do the appetite test to evaluate if the child is having appetite daily. Is it clear? Bring sugar to the child, find how he's sucking that sugar. That's the appetite test. Is it clear? Now you have also to find if the activity of the child, if the child is playing, and you have to also find if the child is apathic or less apathic. So those are the clinical things that you have to do daily for this child. Now paraclinical elements, and also clinically, apart from that, you should do vital signs monitoring. You should do and the monitoring of the signs of infection, provided it came with infections and all that, all the complications, you should monitor them. You should also monitor the etiologies. For the paraclinical investigation, is mostly for the etiologies and also for the complications. So you have to monitor them with paraclinical investigation after every 24 to 48 hours or even 72 hours. So those are the different elements that you have to evaluate in the prognosis for the follow-up. And for the prognosis, you need to know that severe acute malnutrition is the one that has the worst prognosis. Severe acute malnutrition is the one that has the worst prognosis and it always to be admitted and managed in the ward. Thanks for your kind attention.